Um, could you talk about, as a part of the Minority Health Commission and the work that you do as a physician, how can self-help play a role in improving the health and the health care outcomes of minorities in the state?
Okay. First, let me begin with the Arkansas Minority Health Commission. As you heard, we were, enacted in 1991 thanks to former Surgeon General Jocelyn Elders and the Arkansas Legislative Black Caucus. So I'm eternally grateful for the foresight and the insight that that group had. We have a huge charge. We have a charge to address racial and ethnic health disparities across the board. And we're trying to do that in a number of ways, and we have just completed a strategic planning process, so I've got this emblazoned in my head now. We are doing that through research, through policy, through collaboration, through coordination, and through pilot projects. So that, in a nutshell, is the soundbite. But to answer your question, how can self-help improve a person's health? Mm-hmm. Well, first let me say that health and health care are very broad topics. And I would say that health is larger than health care. But self-help goes a long way. Number one, we always talk about behaviors. The behaviors that you choose individually has an impact upon your health. We know that. We know whether you smoke. We know whether you drink. We know whether you have high-risk sexual practices and that type of thing. That impacts upon your health. But I would also say that the same thing in terms of your community. People who live in communities can empower themselves to have a healthier environment that make those bad behaviors less likely, make you more likely to go to the doctor for a preventive visit, make you more likely to get a colonoscopy screening or a mammography. So self-help can span the gamut all the way from individual behavior to the community level to improve health.
Thank you. And I asked that question and because one of the things that I made in my opening comments is I want us to think about, there are others that need to respond, but how do we respond ourselves as well? What are the things that we can do? Dr. Ochoa, as a pediatrician, can you speak to us a bit about how you see the health disparities having a disparate impact on babies? How does that affect the youngest among us?
Well, that's a really good question. I think there are some things that we know about child health disparities. There are other things that we don't. We do know some facts. We know that more minority children in Arkansas live in poverty than non-minority children. We know that nearly 2 out of 3 Hispanic kids live in poverty. We know that in some counties up to 75% of African American children live in poverty. So that we know that poverty and educational status, not just of children, but also their parents who may not have gotten a high school diploma or even an equivalent, we know that people who have less educational attainment tend to have worse health outcomes. But we also know that as the life course continues, kind of back to your first question about self-help, we can talk about self-help with adults, but when we talk about children, there's a limited extent to which self-help of the child can play a role in their health. We know that if an infant and their non-English speaking mother go to a provider where there's no language access for a Spanish speaker, there's not much help that mother can give their infant if there's no connection there with the healthcare provider. We know that if a father doesn't know how to install a child restraint system properly in the car, there's not a lot that the child can do about that and is at higher risk for an injury. But we do know, on the other hand, that if people have more information about the importance of oral health in the first year of life, about the importance of eliminating sugary drinks and sedentary activities from the life of a toddler, the importance of introducing fresh fruits and vegetables at a young age, we know that that has an impact through the life course, because then we see other data from schools that show that half of the Latino boys in Arkansas are overweight or obese, that there's a disproportionate share of overweight and obesity among our non-white children in Arkansas. So the self-help question then I think changes to one of community empowerment to know what to do in those circumstances, but also to help on the public policy side think about where are the intervention points, where are those areas that we can impact. It's precisely those things that I mentioned: injury, childhood obesity, infant mortality.
Thank you. And Dr. Pruitt, I know that so many times we may be prepared academically and feel good about going out and achieving the mission. But I'm just wondering, as we are preparing doctors, how will we be preparing physicians to address specific instances or maybe even the root causes of healthcare disparities? Is that a part of the preparation for physicians? And if so, would you talk to us about that, please?
I can talk in general terms about that. I'm trained as a nutritionist, not as a physician per se,
okay.
but one of the things that I will say that has I've become more aware of in terms of this whole issue of disparities and the medical community in general is, the Institute of Medicine commissioned this report that really got to the very essence of the issue of health disparities in this country, talking about issues of inequality in access to care, talking about issues around cultural factors that impact whether or not there's a relationship at the provider level. Then there's systematic kinds of factors that are going on, and all of these, the confluence of these factors, are really what it explains a lot of what we see today. So that I think that was a clarion call. That report really set the stage for the medical community, understanding that the issue of health disparities is not something that we kind of thought about and maybe it sounded good, but there's empirical evidence for it, that it's pervasive, that it has clearly substantial impact for health citizenry across the spectrum in this country.
So in other words, it's not just a complaint. There is reality to this.
Oh, it's empirically based. This report is available. It's the Bible, quote unquote, for understanding the nature of the problem, the extent of the problem, and the varying levels from the individual through the systemic factors that cause health disparities.
I wish we had more time to explore that, because I think that's a real issue on how minorities can access a healthcare system that many times you might not see somebody who looks like you or is as familiar with your culture. There are so many things to be considered there, but once again, these are things that we know that we can address, and that's the point, that we do something about what faces us.